I think one of the challenge also that I face is like trying to figure out the policy arrangement, because the thing is that we have a health financing that has been instituted in frame in policy in policy and legal framework. But then we had our we implemented our national health insurance. We call it JKN. We implemented JKN since 2014, and it has disrupted the whole health financing arrangement. So one of the challenges is, aside of the health financing arrangement itself, is to navigate around the sort of change in the policy framework for health system, really, especially since reforms has been going on and on. I think following to that, one thing that the researcher in Indonesia and the team also found, and also it in relation to the regional work that we did as well, is that the how do you say the task arrangement, or probably the responsibility for each stakeholders, and how it kind of overlaps each other, but then it doesn't really give a clear sense on on what stakeholders needs to do what. So I think it's more on the task arrangement or institution of responsibility of each stakeholders, because that when we're saying strategic purchasing, who needs to be strategic. We have an implementer, for example, the BPJS, or we call Social Security Agency for Health. But then because they're now regarded as only implementer, they're not given the right to, for example, to change the payment system, or to change, for example, the performance metrics. The regulator or the Ministry of Health needs to do that. So I think because when we diagnosed this a while ago, but when using SPARC, we found that it's one of the biggest challenges that we found in Indonesia. And it also resonated with other countries as well.